can you see my screen with the presentation?
Yes, sir.
Okay. So today we're going to talk about the money. There's a lot of cases and discussion. I don't know if you saw Jerry McGuire, but it talks about show me the money. So an important thing in government is just like private business, as anywhere, is if you have to follow the money, because the money is incentive to get things done, is where people place importance. And if it costs you a lot of money, it gets the emphasis to get some things done. So same thing, if you put money towards an effort, it means that you deem it to be important and you want to try to fix it. So we're going to talk a little bit about the economic impact and the money surrounding health policy. Really important, and I try to give you a high overview, because especially if you stay in government, any government, but state government, or if you follow federal government or your local government, is the budgetary process and the allocation of funds for those entities. So I'll talk to you real quickly on this slide about the Legislative Budget Committee and the Legislative Budget Office. The committee is chaired by either the Lieutenant Governor or Speaker. They change out every other year. 1 year, the Lieutenant Governor is chair of this committee. The next year, the Speaker of the House is chair. There's 6 senators, 6 representatives on this committee. They make up the Legislative Budget Committee. They are the ones who send to they do not make the decision but they are the ones who send to the legislature the estimate of how much money can be spent, and also make recommendations of kind of where those funds should be put. So is that the all to end all? No, but they are a very powerful group, and they do kind of dictate which way the legislature goes. Then, of course, the Legislative Budget Office is their staff that's over there that helps pull their data together. And that is led by Mr. Tony Greer right now. He's got IT support staff and budget analysts. A really key thing, and I used to work for the Department of Health for 10 years in the financial area as chief financial officer and senior deputy. These chairmen of the appropriations that I just told you about a few minutes ago, when you see them walking down the hallway during the session and close to the end of the session, they'll have somebody walking right behind them with a big stack of paper. It's one of these budget analysts from the budget office who follow them everywhere. And as the chairman says, oh, I think I want to do so-and-so, I think money needs to go here, or somebody comes up there and says, Mr. Chairman, I need another $1 million for this program, they take notes and they put it all together so that they can make decisions at the end of the close to the end of the session. So that's the group who does it. There's a group of individuals like that at the federal level who make those decisions. Then also, even internally within the medical center and the Department of Health, there's budget individuals who are putting numbers together for them to make decisions in city, county, so forth. Budget process in this session, February 23rd, is a deadline for original floor action on appropriation and revenue bills. It is a different deadline than general bills. That has not come yet. So the money decisions won't be made till later in the session. They drag it out part of the way because they want to know how much money is being collected this year so that they can make decisions for next year. And if they made decisions earlier on, they would be more wrong because they don't have all the financial information. So that deadline is February 23rd. Throughout the session, prior to the session, now during the session, there'll be several budget hearings, and that's where agency heads and directors and budget folks meet with legislators and subcommittees. The appropriation process, there's a subcommittee for the health department and for IHL and the medical center and everybody else. And that's where the agencies go in and they make their case for what should be spent, for their agency. You want level funding from last year plus some money to do some special projects. So in years where there's a lot of money, to be spent, you ask for more. And in years where there's no money, you ask for level funding. And in years where we're in a deficit, which has happened in the state, you beg them not to cut you. So there's a lot of different levels you go through the process. We're going to talk in just a little bit about what makes up an appropriation bill, kind of when you glance at it, you know what to be looking for, because it's a little bit different than a general bill. And so we'll give you a little bit more information about that. And you have the appropriation process, but you also have finance. And in government, there's two different issues. Appropriations is money that agencies get and entities get to run and operate. Finance is at a higher level. That's the issuance of bonds, and that's for long-term money, multiple year financing for road and bridge projects, or building a wing onto the medical center or the school of medicine. And those are long-term financial that go to a different committee, and that's called the finance committee. Need to have a general understanding about how much money there is. You know, we every month, every couple months for our board, we give them an update of how much money the state is collecting, what the financial condition is, because that sets a tone. And as you guys know, hopefully at your own house, but you know, in the schools, and then also, you know, for the state, how much money dictates the attitude and the directions of what's going to happen. So we always give them an estimate about how much money the state is collecting to spend. Here's some big numbers that the state's never been in the kind of lush financial position that it is right now. We have had a lot of lean years, a lot of deficit years. That they had to cut budgets because the state of Mississippi has to have a balanced budget, so we can't run a deficit like the U.S. Government does. So, but you know, here's some numbers just from the last few years, from fiscal year 21 and 22, which ends on June 30th. State year is different than your calendar year and even the federal year. It goes from July 1st around to June 1st. I mean June 30th. And for 2021, 2022, they collected $2.5 billion more than they thought they were going to collect. And they set out for their estimate. That is a ton of money, considering you see the numbers at the bottom. Our state budget, what they thought we were going to spend is around $7 billion. So for the last 2 years, they collected $2.5 billion more than that, which is considerable amount more money than their estimate. For this this fiscal year, for the month of September, they collected in just that month 126 million over what they estimated they were going to collect. And then for the total fiscal year, it was around 239 million. So it continues that the state's collecting more money than they thought that they were going to collect through the process. So it is getting to be another year where they're having a surplus, and then they've got to figure out how to spend the money. So just so you can be educated enough, and let me tell you again, you're not going to be asked to repeat these numbers. You just need to have an understanding of this. Here are the different categories of tax collection for the state, so you know kind of where the money comes from to help run the university and the Department of Health and everybody else in the state. This is a graph that the Legislative Budget Office puts together every month. And you see here for the month collections of sales tax, individual income tax, and that's the difference between the estimate and what they actually collect, the fiscal year to date and the prior year. So sales tax, you see that they're a little bit down than what they collected last year, but they're still above what they estimated they were going to collect. Individual income tax, fiscal year to date this year is higher than it was last year. Corporate income tax, higher. Use tax, and that's like within that's like online purchases that they just started collecting not too long ago, and gaming. So that's the major categories that makes up those excesses that we showed you on the prior slide. So that's just kind of where the state of Mississippi's money come from, which is important because whenever you're in the budget process or seeing whether the medical center is going to take a cut, or Department of Health or Human Services, you need to know where the money's coming from. So if sales tax are down, in the end, it's going to impact those institutions where they're going to have money to spend. This is a trend line that they put out, and you see through fiscal year 2022, which is June 30th of 2022, and you see the significant increase. By the time COVID hit, the tax collection for the state had really gone through the roof. Something that we don't show on this, but you need to be aware of. This does not include the federal money that has been sent out to the state, which is a tremendous amount of money, which is the COVID money, the CARES money, the infrastructure money. So there's a ton of money coming into the state from the feds that has not been spent yet. Okay, so with that, that shows you where the money comes from, kind of how they come up with the money that they're going to spend. And so what do they need to address in health policy? Not what they do address, because that's a whole different item from what they should address. And we're going to give you some information about what they should be looking at to try to improve health through health policy in the state of Mississippi. Here are the factors for health. Again, it's not just clinical care. Clinical care is an important part of it, but kind of a misconception is the only way we treat people and make them better and have a healthier Mississippi is just through clinical operations. Yes, it is important. You know, every time I say that, everybody say, well, no, you don't, you're downplaying it. It is crucial. It is important. You need hospitals, you need physicians, you need individuals seeing these people to get them healthy again. But there's other factors that play into good health policy to have them healthier and almost some avoidance of clinical procedures, because clinical procedures are the most expensive way you can make somebody healthier. By then, somebody's really sick, and so you got to do a lot more to get them healthy than it is if you address some of these other health issues. So health behaviors, providing rates of, here's the factors, providing rates of alcohol and drug use, diet, exercise, sexual activity, tobacco use. You can go on and on and on. These are just a few examples. Clinical care, the details of access to care, the quality of care, the availability of primary care physicians, the scope of service for nurse practitioners, midwives, community health workers. All those are clinical care type issues that you can address that are health factors in providing services. Social and economic factors, we could spend a whole semester just talking about that. That's education level. The smarter folks are, the higher education, and I don't mean smarter, but the more access they have to education, the more informed they are, the better health decisions they can make, that they can treat, maintain, and get the health care that they need to stay healthier. Employment, you know, it's shown through studies that individuals who are employed tend to be much healthier than those people who do not have employment. Income, if you have access, if you can get a car, you can live in a house that doesn't have mold and it's not falling down, that has heat, that you can afford to go to a doctor, you know, to see a doctor if you're sick. Family and social support, shown that two-person family, you know, those individuals tend to be healthier and make better health decisions in eating, food, exercise, ability to get an education. So it all kind of rolls up together. Community safety, again, you know, if you're in a neighborhood or area that you can't walk, you can't get outside, you know, you may get assaulted if you walk around the block, or you know, one thing we always thought, oh, you live in the country, you can go walking all the time. Well, if you live in the country on a road where they run tractors and big log trucks down the road, you can't walk up and down the road. You know, you don't have a walking trail. Can't walk through the fields because you get, you know, you're up to your ankles in mud, or you know, you get chased out by snakes. So the area that you live in can also contribute to your safety factor. Then the physical environment is air, water quality, as well as housing and transit. Again, you know, do you live in a house that has heat? Do you live in a house that doesn't have mold? Do you have transportation? Because again, if you don't have a local primary care physician or access to a nurse practitioner or nursing or services, but you do have a car that you can drive to get those services, well, that's okay. But you need to have those benefits to be able to be a healthier community, a healthier person. Health behaviors, here's some of the things that cost the United States, Mississippians, local folks. The leading causes of death and diseases are attributed to unhealthy behaviors. You know, those are self-decisions people are making. You guys probably have these numbers are as good or better examples. But smoking, easy example, that's why we use it, because the numbers are easy to come by. Kills 480,000 Americans. Smoking causes cancer, heart disease, stroke, lung disease, diabetes, chronic obstructive pulmonary disease. Smokers die 10 years earlier than non-smokers. Cost about 170 billion annually to treat tobacco-related illness, another 156 billion in productivity loss. So that's a decision, a personal decision that folks make that have and cost impact and productivity and, you know, quality of life for individuals who choose to do that. And so that's a decision which is hard, but it's one that can be made to avert that. Alcohol and drugs, excessive alcohol, 88,000 deaths each year. 46 people die each day of prescription overdose. It does not include fentanyl now, which is a huge issue in the United States. Alcohol, about 249 billion in lost productivity, 193 billion in related illicit drug crime, health cost, and lost productivity. That also does not include the cost of health insurance to help cover these individuals, to help treat and go towards maintaining a work environment with somebody having health insurance to cover some of this stuff. So tremendous activity. This is just showing personal decisions that have a big impact on the cost of healthcare in the states. Sexual activity. A lot of people don't address this. We like to just let it know that it's not just those direct things, but approximately 3 million unintended pregnancies each year, approximately 200,000 teen pregnancies annually nationwide. Sexual transmitted infections cost about 16 billion annually. So again, if you're looking at the cost of decisions and health policies that can address those things, is tremendous cost to the structure and the process in the United States. Clinical care, again, usually when we have a discussion about healthcare cost, it goes straight to clinical activity and a tremendous amount of cost in that area. But you need to know that's not the only cost. Cost of clinical care in 2020 was about 4.1 trillion, about $12,500 per person, almost 20% of gross domestic product, and it increases about an average of 10% a year, which is the highest level of any service area where price increases. Access, about 30 million Americans without health insurance, generally considered the first barrier to receiving quality health care. I always like to add this in. Health insurance by itself is not the answer, it is a tool to allow you to have access to health care. Most of you guys have some health insurance in some manner, but your health insurance company does not call you up and say, have you gone to the doctor to get your blood pressure checked? Have you gone? And, they cover it and enable you to make the decision, but you're going to have that health literacy to know when and where to go get the services, and then health insurance enables you to do that. So it's not the answer, but it is a tremendous tool to have this to go towards resolving the issue. Uninsured are much less likely to have primary care providers. They're less likely to have them than the insured folks. They also receive less preventive care, dental care. You guys should know more than anything else. Dental care is a primary driver. If you have bad teeth, you have poor health, and that's been proven through many studies. Chronic disease management, high blood pressure, overweight, other issues that you can get addressed through seeing a healthcare professional that you can do through insurance. Behavioral health, counseling, smoking, getting away from smoking. Without the insurance, they get diagnosed less later, and they also just don't have access that you do to people who do have insurance. Quality, about 20% of discharged elderly patients return to the hospital within 30 days. Hospitals acquired infections killed almost 100,000 Americans in 2007. Between 44,000 and 98,000 Americans are estimated to die from medical errors each year. So even when you do get access to clinical care, sometimes a much smaller percentage, but sometimes they create more problems than you had to begin with. And so that comes within quality of care, quality assurance, follow up to make sure that the clinical services that are being provided are at the appropriate level, and when mistakes are made, they're cleaned up, activated. You have board of medical licensures and all who follow up and make sure those poor performing primary care physicians, nurses, everybody else get addressed so don't continue to be in the system. Social economic factors. Again, this is something we could talk about for years. And a lot of these we couldn't solve in those years, but they are issues that are primary, impactful, and they are things that can be addressed. They are just huge issues in which to address. Education, higher levels of education can lead to greater sense of control over one's life, healthier, linked to health, better health, healthier lifestyle, fewer chronic conditions. It gives you access, but also that education gives you a higher health literacy to understand what's going on and identify bad issues. Also connected to lifespan. On average, college graduates live 9 more years than high school dropouts. Employment, working poor face many challenges. They are less likely to have health insurance access continued on. Unemployed individuals are 54 more likely to be in poor or fair health than individuals who are employed. Income, the higher income levels give you access to doctors, physicians, hospitals, locations, but also basic things like housing, transportation, ability to get treatment, even the friends you hang out with, incomes related to that. Family and social support, again, that structure and how impactful has an impact on the health issues. If you live in inner city and don't have the support of family or a good social structure, it shows that health outcomes are poor. And also in rural Mississippi, one issue we've got as far as family and support, social support. They don't have access, ability to get somewhere, or family members who are checking and making sure that you're healthy. And then community safety, we go back to the housing, to ability to have exercise, to get to a gym, to do things to make yourself healthier. So all those are factors that contribute to you being unhealthy that can be addressed, and health policies can be intercede into those to give you a better chance. Physical environment, air and water quality, those are some simple examples. About 1 in 8 Americans have been diagnosed with asthma. One of the earlier issues with public health that brought to a front point is the Broad Street issue in London, where cholera outbreak was getting out of the water system in the London area, and they just thought they were treating them and they were trying to get them better, and it turns out there was cholera in the public water system. They finally determined that. Then they got safe, reliable drinking water, and people began to get well. And that's a health issue that people addressed, and a health policy, in a way that enable people to get healthy and have an alternative, and just having safe drinking water that saved lives. Housing and transit, lead exposure, improper insulation, temperature, asthma, mold, dust, residential crowding, all those issues that will turn into poor health outcomes if not addressed. And then transportation is a key, especially in Mississippi, is access and safety to get services. OBs, we've done studies over the years. We got reports on it. If you look at the numbers in Mississippi, and they all say access to care, we don't have enough primary care physicians. If you look at OBs, we probably have enough OBs in the state of Mississippi. It's just where they're located. If you're right outside of Memphis in DeSoto County, or Tupelo, or Jackson, or Hattiesburg, or on the Gulf Coast, you can get to see an OB. I mean, there's plenty of them. You get access. When you get to be 60, 70 miles outside of Jackson, that becomes a problem. So you either got to get the OB to move out to Lena or to Sugar Lock, Mississippi, or you got to get people transportation access to move their bodies from that community to Jackson when they need access to that kind of health care. And then, of course, business costs, which is huge. In 2020, the Standard Company provided health insurance policy. It was about $7,500 a year for single coverage. On average, employers paid about 83% of the premium, or about $6,200 of that. Employees paid about $1,300 of it. So the cost of that continues to go up as health insurance to cover people who are in the workforce, but also due to lack of illnesses, there's a dollar loss in productivity of about $950 billion nationally spent on healthcare benefits, and about 0.61. That's not right. 61. 61 billion. It's 610 billion is what that's supposed to be. Productivity is lost to injury and illness, and I just saw that, so I'll change that. So that is just to let you know that why this is so important.